Hi, my name is Chavela Brown. I'm RN at University Medical Center in Lubbock, Texas. I'll be talking about our poster, See the Difference, a collaboration between infection prevention and control and our environmental services. It included conducting rounds and providing education regarding our enhanced contact isolation signs to prevent the spread of healthcare-acquired C. difficile. Being admitted into the hospital increases the risk of getting a healthcare-acquired infection, especially through the hospital environment. Those pathogens, such as C. difficile, can remain on inanimate objects for months, and inadequate cleaning increases the risk of this transmission, especially our multi-drug resistant organisms and C. difficile. Our high-touch surfaces, such as bedside tables, bed linens, IV pumps, and anything in the patient care environment can spread these pathogens. High-touch surfaces are often overlooked areas by environmental services through routine cleaning. So we identified this and decided we need strict terminal cleaning of these rooms after the patient is discharged, and increasing a daily room cleaning would lead to a decrease of hospital transmission. So despite increased awareness and improvement of care, healthcare-acquired infections still occur. At UMC, we decided we would change not only our contact isolation signs and make it enhanced contact isolation sign. Our contact isolation signs are green, while our enhanced contact isolation signs are pink. By doing this, it alerts our environmental staff that these rooms are to be cleaned in a higher standard. And we'll go over that in just a minute. Our methods are our IPNC, or infection prevention and control staff, track all C. diff patients within the hospital, ensuring that they have a isolation card and determine whether it's healthcare acquired or community acquired. Infection prevention and control will verify and provide up-to-date C. diff information to our EVS every morning. EVS will review this and provide this information to the staff daily. We provide education to our nursing staff about in real time what the pink isolation sign means. IPNC and EVS will round on all these rooms daily. EVS will clean these rooms to a higher standard, which means the room is cleaned twice per day and then again in the evening. Other things that the environmental services will do, not only with the pink sign on the door, we will use a bleach-based disinfectant for cleaning, enhanced precaution. They'll have a red toilet caddy, and then the EVS team leads perform black light audits to validate that the high-touch areas have been cleaned. We continue to monitor our healthcare C. diff infections, infection prevention and control. We started this program in late December of 2022. And as you can see by our graph, we saw a sharp decrease in our healthcare acquired infections in February and March, with a spike in April. That spike was due to late testing or patients on antibiotics for a longer period of time, things that we could not avoid, but it was not passed from patient to patient. We are now starting to see another decrease and continue to work with our environmental service staff making rounds. This also provided autonomy for our environmental service staff and giving them permission to speak and educate our nursing staff when the patient should be on enhanced precaution compared to patients that should be on contact precautions. And they have the backing of infection control to do this. So we know simply improving infection control practices such as hand hygiene and daily room cleaning can decrease the number of hospital-acquired infections. And real-time education and continued monitoring is a factor to ensure that staff are aware of appropriate isolation status and cleaning needed for patients with C. difficile. Some of our limitations are continued education, because we see turnover of both nursing and EVS staff, improper use of or lack of use of patient protective equipment, and our healthcare providers, our attendings and residents wanting to get our patients off of isolation early and not using isolation at all. The impact to nursing is an increased length of stay of patients with comorbidities, increased use of multiple antibiotics, and increased numbers of patients on isolation, and a lack of knowledge of the ability to educate patients appropriately and family regarding the care and identifying risk factors to prevent the spread of this disease. Thank you.